The spirituality compartment or component of things is really important. I mean, I feel like our relationship with God or whatever the person's coming from, that relationship is just as important as the relationship with your family members, with your spouse, with your friends. It's an important relationship, and depending on how the client views that relationship, that's either a strength that we want to increase or a hindrance that we want to understand. Did you have some hard experiences around this and provide some healing? I always tell people, I'm not a theologian. I did not go to Bible school. I'm just a regular person trying to, walk my faith and live my faith. And so I can't answer certain questions because I don't know the answer, and I'll say I don't know. But I do feel like understanding that relationship is an important one to know. They might not even have a relationship, but I need to know if they do or not, because I want to support that just like I do any other relationship. But the other things, from just a more underlying foundational aspect of psychology and understanding spirituality, there's a lot of things that we know. There's research that's come out that inherent in the relationship, the therapist's values end up kind of being transferred a little bit to the client. So that's an important thing for informed consent. If you're a client and you don't want those values, it's important for us to know that, actually they do get transferred a little bit. And it's not something that maybe we're aware of, but it does happen, just like values get transferred from from parent to child. They're not explicit typically, but they happen. Well, that's an informed consent issue for the client. The client needs to know what our value system is. And it doesn't mean that we're going to push it on people. That I don't think any of us would ever do that. But so I think that's one aspect of why I just want to put it out there. But another important aspect of it for me is that when, my therapeutic approach of acceptance and commitment therapy really encourages people to take bold action to live a life of meaning. And if I'm going to ask my clients to do that, then I need to do that myself. So it's a bold action, I feel like, to say I'm a mental health provider who is also a Christian, because that's not typically what you see, and there's a little bit of, sometimes can be some pushback from that. But I'm not going to ask my clients to do something that I'm not going to do myself. If I'm asking my clients to live out their beliefs, across work and family and fun and all that stuff, well, it'd be a little bit contradictory or hypocritical if I also wasn't willing to be bold in that. So that's another reason why it's important for me just to tell people that these are my core values. And in the therapy room, when I'm asking about relationships, so tell me about your relationship with your family and who lives in your home, and tell me about your friends and things like that. And I ask about their relationship, their spirituality. I just say, well, tell me about your spirituality. And then I want to know, if they talk about God or whatever, I want to know, well, how do you see God interacting? How do you see him playing out in your life? And do you feel like he's a punishing God, or what is he like for you? Same questions I would ask about how they see their spouse. And then I'll, ask, sometimes people will ask me if they can pray. And sometimes I'll just ask people, do you want prayer to be a part of our therapy sessions? And if they do, then great. And I'll ask, do you want to pray, or do you want me to? And if they don't, that's great. And, it's just an open conversation. I just feel like it's just another relationship that we should talk about. I don't see why not, really.